Case Study Number 1. Summary. John Doe, a 60-year-old male. John presents with acute chest pain, shortness of breath, and diaphoresis. He has a history of hypertension and diabetes. Current situation. John arrives at the emergency department with acute, severe chest pain radiating to his left arm, shortness of breath and sweating. His vital signs are: blood pressure 160/95 of a millimeter of mercury, heart rate 110 bpm, respiratory rate 24 breaths per minute, temperature 37.2 degrees Celsius 99.0 degrees Fahrenheit, oxygen saturation 93%. Questions. Question 1. What are the potential diagnoses for this patient and the pathophysiologies? Answer A. Acute myocardial infarction AMI. A condition where blood flow to the heart muscle is blocked, leading to tissue damage. Pathophysiology involves plaque rupture and thrombus formation in coronary arteries. Symptoms include chest pain, shortness of breath, and diaphoresis. Key points include rapid identification and intervention to restore blood flow. Answer B. Pulmonary embolism P. A blockage in one of the pulmonary arteries in the lungs, usually due to blood clot. Pathophysiology involves thrombus formation, often in the deep veins of the legs, which travels to the lungs. Important considerations include rapid diagnosis and anticoagulation therapy. Question 2. What immediate nursing care is required for this patient? Answer A. For acute myocardial infarction AMI, administer oxygen therapy, aspirin, nitroglycerin, and morphine as prescribed. Monitor vital signs and prepare the patient for emergency procedures, such as percutaneous coronary intervention PCI. Answer B. Pulmonary embolism P. Provide oxygen therapy and anticoagulants as prescribed. Monitor for signs of hemodynamic instability and prepare for diagnostic tests such as a CT pulmonary angiogram. Educate the patient on prevention strategies such as anticoagulation therapy and compression stockings. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer: electrocardiogram ECG to identify ischemic changes and arrhythmias. Cardiac enzymes, for example troponin, to assess for myocardial damage. Chest X-ray to rule out other causes of chest pain and respiratory distress. CT pulmonary angiogram if PE is suspected, to visualize the pulmonary arteries and identify emboli. Medication information. Aspirin, antiplatelet agent. Considerations: monitor for signs of bleeding and educate the patient on the importance of medication adherence. Side effects: gastrointestinal upset, bleeding, and allergic reactions. Nitroglycerin, vasodilator. Considerations: monitor blood pressure and watch for hypotension. Educate the patient on the proper use of sublingual tablets or sprays. Side effects: headache, dizziness, and hypotension. Morphine, opioid analgesic. Considerations: monitor for respiratory depression and sedation. Educate the patient on the risk of dependence and potential side effects. Side effects: constipation, nausea, and respiratory depression. Heparin for P anticoagulant. Considerations: monitor for signs of bleeding and regular blood tests, for example.